I think the big thing for any patient would be to have a home practice to go back to in the future. Now, we aren't doing these treatments for the next 6 months, year, even 5 years. We're aiming for a long period of time that these should work. If you look after a full mouth reconstruction, these can easily last you 20, 25 years. That becomes even more prudent when it's on implants. Now, there's probably about 5 big implant companies, but there's about approximately 1,000 companies that make implants. So if you have an implant done abroad and you need some attention 10 years later, it's very feasible that implant is not manufactured anymore. It's almost like trying to repair an old car that you cannot get the parts for. So when you're dealing with a mainstream clinic that is using one of the top 5 implants, you know that that implant, if it needs any attention, you're going to have no problem, even if it's not at our clinic in the future, because the parts would be available. I think other things that probably don't come to mind quite so readily are that we're a very regulated profession in the UK. So with that regulation comes responsibility, comes ownership, and the patient knows that if they do have an issue, and if they followed the pathway of the system of the practice of hygiene appointments and regular checkups, someone will be there to help them through it. They won't be stranded on their own, having to go back to another country or hoping a clinic accepts them here to deal with a problem. So again, these are several big areas to think of before going to clinics abroad for treatment, as attractive as that may be.